You want to give us a thumbs up when we're live? Okay, we're live. Hello. Good afternoon, Mendocino County. My name's Sarah DeKett, and I'm the Public Information Officer with the county. And we're here today with Health Officer Dr. Noemi Dewin. We're here with Supervisor Ted Williams and our Department Operations Center Manager Becky Emery. We're going to give you a little update from the county on COVID-19, talk about the new health orders that are coming out, and then we're going to take your question live on Facebook. Leave your questions in the comments, and we'll try to get to as many as we can in the next 45 minutes. With that, I'll turn it over to Dr. Dewin for the COVID-19 update.
Hello, Mendocino County. Sarah, can you hear me?
We sure can.
Okay. Hello, Mendocino County. This is your health officer, Dr. Noemi Dewin. We would normally be having our live stream on Friday, but Friday is July 3rd and is a county holiday. So we decided we should do it today because we don't want to go a week without giving you the chance to hear from us. And we will be going back to our Friday live streaming on July 10th. So this has been yet again another rapidly evolving week in the COVID pandemic. This is being seen across our state, and in fact in the western states of the United States, that we're seeing a very worrisome increase in numbers of cases that are definitely supporting this modeling that we will be having a peaking of a surge in September around Labor Day. We're seeing, I think, what would be called the early phases of that surge happening now. I will continue, as I have always done as your health officer, to base my decisions on fact and science and not on political pressure. Therefore, I know that what I'm going to be sharing today is going to be difficult because essentially what I'm going to be telling you is that with the new sheltering in place orders that are coming out tomorrow, there is going to be some element of going backwards. I have shared that I do not want to go backwards as a county. I want to hold the line where we are at and when possible have further opening. But what I'm going to be sharing with you today is that there is an element of what's coming out in the new orders that is going backwards. And I will also share with respect to how local health officers operate that we are being closely followed and monitored by the health officer, the director of health for our state, which is Dr. Angel, as well as the Secretary of Health, Dr. Galley, and our governor. So we health officers across the state of California had an emergency call on Sunday from Secretary Galley and Health Director Sonia Angel, noting that the state is watching us, that we have watch lists where we will be placed if we have alarming results in our data. Thankfully, Mendocino County is not on the state watch list yet, but we could be in the coming weeks if we don't see a flattening of our curve and slowing the spread. And what was made clear to us health officers on Sunday is that the state can step in and force us to close or go backwards if the health officer doesn't make the right decisions themselves. So the decisions that I'm making for our sheltering in place orders that are coming out tomorrow are based on the fact that I do not want the state to step in and close us. I want to be able to keep the local health officer authority intact. And so therefore, everything that I'm doing is in response to the data and the science, but also to keep our local county autonomy. So what was brought up to us by the governor, all of the health officers, is that gatherings across our state have been a major driver of the surge that we're seeing now. Gatherings for Memorial Day, increased tourism leading to gatherings. We have parties that happened around graduation. Many of these gatherings are happening in people's homes. This is mixing together of people that have not been together before, that then go out and mix with others. And it's led to the surge, a primary factor behind the surge that we're seeing now, as well as individuals refusing to wear facial coverings, refusing to social distance. And in fact, I got some very worrisome reports about tourism on the coast of Mendocino County over the last week, where there was crowds in the streets, people not facial covering, bars crowded, and this is extremely worrisome. This is going to lead to surges. So based on all of this, there are going to be new orders that are going to be coming out in the next day, and these orders are going to include that the order themselves is going to be. I don't want to use the word streamlining and have the wrong impression, but our prior orders had a lot of historical elements in it from the earlier orders. And this new order, which is going to be coming out on Wednesday, July 1st, tomorrow, and is going to become effective on Friday, July 3rd at noon, this new order is not having all of that historical information packed into it, but is focusing on two main categories: individuals and activities, and businesses. And in terms of businesses, there is not going to be any further opening of any businesses from where they are now. So let's specifically talk about lodging. Lodging was opened for tourism and leisure in my last orders, and they will not be further opened with this new order. But on the other hand, they will not be restricted any further than they are now. So as an example, lodging for tourism and leisure is staying. I'm holding the line from what my prior orders were. The governor has made very clear that bars are going to be closed in counties that have watch lists. And I do not want to close our bars. I want to hold the line to the extent possible, but this is where you're going to be seeing some what we might call going backwards. It's going to be in the area of bars and the serving of alcohol in businesses. So the governor has made very clear, this is the area that's being watched. It's an area across the country where we think that there have been gatherings that have led to outbreaks. So what we're going to be doing, what I am going to be doing with the bars, is that the serving of alcohol, whether it's in a bar or in a restaurant, must end at 8 p.m. So the last serving of alcohol in restaurants, bars, or any facility that serves alcohol will be closed. The serving of the alcohol will end at 8 p.m. Another area that's going to be in this new sheltering in place order of importance is that it's coming out on the 3rd and it will extend for a month. So it is not the case that my orders are being rescinded or going away on July 3rd. There's new orders coming on which will extend for 1 month, and they're coming out on July 3rd. The other change that will be clear in these new orders also comes from the governor. The governor does not want to see social bubbles in any of the health officers' orders. So the bubbles in my orders are being changed to what we're calling stable bubbles. Stable means stable group of people for 4 weeks or more. So this is absolutely not a gathering. It's not people coming to mix together and then go into other groupings. It's a stable group for 4 weeks or more. The child care and children's extracurricular activity bubbles are staying the same. The household support units are reducing from groups of 12 to 6. There's also a similar reduction in the work groups that are in the orders. Stable group work groups are going from 12 to 6. Now these groups or bubbles, the point about them is that within a bubble, there is not the need to have social distancing or wearing facial coverings, because the idea is this is a stable group. The facial covering order is also having some changes coming out tomorrow to reflect the idea that those workers who are required to do work that treats a person's head, face, or mouth in the non-medical setting, so this would be personal care services like facials, eyelashes, barbers, that they will need to have an additional facial covering. So not only a cloth facial covering, but some type of additional facial shield or plexiglass screen to just recognize that there's additional risk there with treating the face when the person, the customer, can't wear a facial covering themselves. So with that, I do want to, again, announce that my new orders will be coming out tomorrow, effective on Friday. And I've given you a highlight just now on some of the order changes. And again, this is being triggered by the governor, also triggered by the very worrisome data that we're seeing coming out of gatherings, and also the concern that we're having around enforcement issues. So thank you. And Sarah, I'll pass it on to the next speaker at this time.
Thank you, Dr. Doohan. We're going to go over to Supervisor Ted Williams.
Good afternoon, Mendocino County. We knew health orders would be modulated in response to trending data. The situation is growing old, but we are at the start of the pandemic impacts in Mendocino County. We see the state taking action where counties have failed to respond. Staying responsive to conditions is our means of maintaining some amount of local control. If we wait for the state to close sectors, we won't be in a position to time the reopening. I'd like for you to imagine a tsunami. An earthquake is hit. We know a wave is coming, but we don't know exactly when it'll hit or how much damage it will cause. Do we stay put because nobody has died yet? Or because more people die of heart disease? No, we move to higher ground. Facial coverings are our best tool for mitigating the rate of spread. The covering requirement is based on what we know about the role respiratory droplets play in the spread of the COVID-19 virus. It's actually quite simple. Imagine a friend sneezing on you with and without a facial covering. Education is another important tool, especially for visitors. We have new posters. These are to convey a ubiquitous, consistent message. Let's look at these. We have 8 by 11 and larger in both English and Spanish to remind the public, especially visitors, that face coverings are required. Here's the Spanish version. In that poster, we also have a reminder about keeping 6 feet of physical distance between folks not in our own family unit. Enforcement obstacles are recognized. Brainstorming continues at a state and local level. I ask you to encourage face coverings not only because of the order, but out of personal responsibility to save lives and save our local economy. Your neighbors are counting on you. Thank you.
Next, we're going to move over to Becky Emery, our Department Operations Center Manager, for an update on Optum and the Operations Center.
Good afternoon, everyone. Thank you, Sarah. So within our Optum Serve, we are continuing to provide support to the community through testing and surveillance of 144 tests a day. We are also providing support with our walk-in system. So we have about 50 people a day being tested through the Optum Serve walk-in, and those tests are being provided through the county in partnership with UCSF. And so those individuals are receiving their results through the UCSF information as opposed to Optum Serve, but they are people that are able to come in and be tested right away rather than having to wait through the appointment time. So we have been able to support that effort, and we really appreciate that partnership both with the testers that are working there as well as UCSF supports. We are continuing our UCSF support and surveillance on the coast as well. Last week, we did 100, in partnership with Mendocino Coast Clinic, they did 100 tests. They also partnered with Anderson Valley to do 100 tests there. And in Laytonville, 100 tests were performed and offered there as well. And this week, we also provided surveillance through South Coast, the clinic with RCMS, working with them to do 100 tests on South Coast. As we're moving forward, UCSF has continued that support to our community and to us. And so we will be partnering with the various clinics to continue that surveillance through the month of July and working through how those arrangements are going to work and getting that information out to the community as quickly as possible. That meeting is actually occurring right now to work on that scheduling. So we're hoping to have that posted very soon. In addition to that, we continue to work with our community and want to ensure that we are protecting the public and are responding to any and all outbreaks. I know that there's been a lot of questions around the Optum Serve and the reasoning that it's really posted in the Ukiah area, but at this time, that's where we are seeing the most significant community spread. And so we have been working really diligently to be able to address that need and to be able to respond to those individuals that are experiencing this coronavirus right now and to help keep everyone as safe as possible. And I really appreciate Dr. Duhan's orders to ensure that our community is using masks and staying safe to the best of our abilities. And so with that, Sarah, I'll go ahead and turn it back over to you.
So we're going to take some questions from our viewers. So the first one I see is from Stephen of what is the positivity rate for COVID-19 in the county?
So we don't have, Becky, I don't know if you have that data in front of you right now. We don't have that. I don't have that actual data, but we could certainly post that. If Becky, you don't have it on hand, we could post that after this live stream.
I don't have that data live with me at this moment, but we can certainly get that information.
But keep in mind, when we talk about the rate and the changes that are being made in the order, the changes are to prevent us from becoming overwhelmed. This county will be more effective at preventing that overwhelm than dealing with it once it's here. So you can't look at just how many people are ill today. You have to look at the trend within the region and where we may be if we don't act.
Our next question is from Marissa. Does the PCR testing, which looks for viral RNA, only look for or find live active viral RNA, or can it also pick up old or dead RNA?
That's a great question. This is Dr. Doohan here. We actually have a name for that. We call it detecting dead bugs. The idea here is that, yes, you can have dead viral shedding that can be picked up long after a person is actually still infectious. So what we do is we do not recommend that someone is tested again after they've initially had a positive PCR test from a swab. We don't recommend that they are tested again. What we do is we say that if you go into isolation for 10 days from your positive test date, then after 10 days, you're no longer infectious, and we would not recommend an additional test because the test will pick up dead virus particles being shed. And we found up to 70 days after the initial positive test that someone could be showing these dead bugs. But where studies have been done where they've been cultured, it actually shows that they're not live viral particles. They're not infectious. So a 10-day isolation period from the day of the positive test, 10 days after that in isolation, the person is no longer infectious.
We have a couple questions coming in about OptumServe. It looks like a lot of people are experiencing wait times of 4 to 7 days for the results. Can we speak to the delay in Optum results?
So OptumServe,
yeah, go ahead, Becky, go ahead.
OptumServe is contracted through another lab to process those tests, and that lab has been processing a significant number of tests, so we have seen a delay in those responses. We want to encourage people, especially anyone that is symptomatic, and I will certainly turn this over to Dr. Doohan to add to, that if someone is having symptoms that they need to really stay safe and isolate at home waiting for their results. I know it's a longer delay, but it's really important that they protect themselves.
Yes, and OptumServe is taking up to 7 days to get the results back. This is a Quest lab issue, and you can see if you look at a map of the state of California how we're surging across the state, and many, many clinics and the OptumServe sites all around the state of California use Quest labs. So that particular lab is getting impacted heavily by the numbers of increasing cases in our state. So when you do get tested by OptumServe, it may take up to 7 days to get the result. And for this reason, anybody who is sick, having symptoms of COVID, should self-isolate for 10 days from the onset of their symptoms, even if they don't have a result back.
Our next question comes from Patricia. How do we make testing available in far-reaching corners of the county?
So we are partnering with our clinics to try and do that, both on the South Coast and North. Like I said, we also tested up in Laytonville. So trying to get to those far-reaching areas. We've done a significant amount of testing in Round Valley over the last couple of months for outbreaks and to provide support there. So really and truly, we are working very diligently to be able to provide that support throughout the county.
And I would add, it's not for lack of initiative. Staff has been working hard consistently to come up with a testing solution. It comes down to money. The lab test is about $200 per person per test. And so if you start scaling that up to 300 people countywide per day, you're talking millions of dollars. And we know the clinics and hospitals, they've received some amount of funding under the CARES Act, not nearly enough. They would also like to be partners in testing, and they're wondering how to pay for it. And so there is an effort underway, active, to come up with a testing solution. But ultimately, it comes back to dollars and how much assistance we can get from federal and state partners.
We also have a question from Gino and a few others regarding what's the current countywide policy pertaining to masking and any special requirements in terms of masking for children.
So there are two orders that I, the health officer, have. One is around medical masking. So that's a separate category that has to do with, what's done in skilled nursing facilities and so on. What I think this is referring to is facial coverings for the public. So there is a facial covering for the public order. You can find it on the website for the county. It's been there for, probably 2 months now that we've had a facial covering order in our county. But also the governor, the state of California, has a facial covering for the public order as well. The exception to the facial covering for the public is that children under 2 and under should not wear a facial covering. And additionally, people who have medical reasons not to wear a facial covering are exempt. In my order that's coming out tomorrow, you'll see that there's an option to wear a face shield instead of a cloth facial covering, and this is also in line with the governor. This face shield should cover the whole face and come down below the level of the chin, so when the person is speaking, the face shield still covers the mouth. So those would be two aspects to the new facial covering order. It's a revision, so the order has been there for quite some time, but this is an order of the health officer. A question may arise about how do we enforce this order. Obviously, this is difficult to enforce, so we do rely on individuals to understand, as Supervisor Williams said, the importance of wearing this order, these facial coverings and following this order, because it is absolutely proven that these facial coverings are effective and control the spread of COVID.
We have a couple similar questions, one from Pam and Rose asking about what we're doing to keep our small community safe from a lot of tourists that are coming into the area and ensuring that we have the ability to clean up after people safely.
Well, Dr. Dewan here, I mean, there is what we're doing to, with my new orders that are coming out tomorrow, this is limiting tourism. We're not further opening up lodging for tourism and leisure beyond what I have done in my prior orders. Also, the limitations on the serving of alcohol, that serving of alcohol must stop at 8 p.m. is also an effort to control gatherings, because of course, when people do drink alcohol, there is a tendency to lose inhibitions and not follow health officer orders. Both of these elements in the health officer orders are affecting tourism and what risks tourism might present to our communities. Also, in the new orders, there is going to be a requirement that all businesses must post additional county signage, which Supervisor Williams just went over in English and Spanish, prominently at their entrances to highlight the rules around physical distancing and facial coverings in our county, so that visitors who come from the outside to our county are aware that we have a unified message across our county that these are requirements of physical distancing and facial coverings.
I see a couple questions around gatherings. One, are weddings allowed? And can you address if gatherings are allowed in general as well?
So the governor has banned all gatherings of any size, and that would include a gathering for a wedding or any other gatherings that one might have. The exception to this is that places of worship are allowed to have gatherings, and that is an exemption that the governor put in several weeks ago that is reflected in my order. So for an individual that did have a wedding in a place of worship, this would be allowed, but this is specified to be a place of worship that is historically known to be a place of worship. In other words, you wouldn't be able to just set up a business just to have weddings and call it a place of worship. So to the extent that a wedding occurs in a place of worship, it is allowed per the governor's allowance for places of worship to open for gatherings.
We have another question about what percentage of people tested never show symptoms? Do we have any information on asymptomatic versus people with symptoms that test positive in the county?
So there is a distinction about pre-symptomatic versus, which is somebody that's going to develop symptoms. So they tested early in the course of the illness and then developed symptoms after they tested, versus someone who absolutely never developed symptoms whatsoever. We would have to go back and look at our county data. But from what I recall, because of course I track this with the CD team, it seems about 5% of the individuals that we've tested have not developed symptoms and have remained asymptomatic. But we would have to, that would have to be another thing that we'd have to look at the data and go back and take a look.
We have a couple questions asking for clarification on the stable bubbles to go over what number of people are allowed in each type of bubble.
So this, what we were calling the social bubbles, we're now calling stable bubbles. This is from guidance from the governor, where social bubbles are not going to be tolerated in health officer orders. A stable bubble highlights that it is stable for 4 weeks or more, whereas a social bubble could be misinterpreted to mean that you could have several of them with different groupings occurring. So a stable bubble is for 4 weeks or more, and we have 3 types. One is called well, there's two children's bubbles, stable bubbles. One is the child care bubble, and the other is the children's extracurricular activity bubbles. These are for stable groups of 12. That includes any adults that might be in them, and they should not change their membership, as I said, more frequently than every 4 weeks. And then there's the household support unit bubbles, and these are also stable bubbles. They must stay the same membership for 4 weeks, but those have been reduced from a group of 12 down to a group of 6. So the household support units are 6. The child care and extracurricular children's activities groups are 12 each, and they're all stable for 4 weeks at least.
And we have a question from Cindy about the business certification. Do all businesses need to recertify, or just higher risk businesses?
All businesses need to certify initially, and then the higher risk businesses, there's some various nuances about higher risk businesses. Supervisor Williams, do you want to speak at all about the work that the ad hoc has been doing with West Company?
Yeah, I would recommend that every business read the new order, and the order will tell them based on their sector what they need to do. Some businesses are required to attach a formal written plan. You can think of it as an essay describing how they will meet the requirements. The reason we went this path is rather than having a one-size-fits-all that some of our rural businesses may not be able to meet exactly, we're giving some latitude in allowing the business to come up with a solution so long as they meet the state and local requirements. And so it's hard to answer the question specifically without knowing which sector. But if there are questions, feel free to reach out, I imagine, to the call center. West has been active in helping. And of course, you contact me or contact your own supervisor if you need help with interpreting the self-certification process.
We have another question for Dr. Duhan. Any new information on contracting the virus a second time? And is there a concern about antibody enhancement?
We don't have any evidence that any solid evidence that an individual can contract the virus a second time. So I don't know what the question is about antibody enhancement. Not sure what that means. I will tell you that the antibody testing that we're doing at this time is not meant to be to prove that someone has sufficient immunity. The antibody testing is essentially for research purposes. What we do have in terms of diagnostic testing is the PCR test, which indicates that a person has been infected with COVID, and then we have them isolate for a certain period of time. And after they've completed isolation, then we presume they're immune and that they're also no longer infectious.
Wonderful. We have a couple questions. This kind of goes back to testing of who's responsible for obtaining adequate and accessible testing for coastal residents. And if there's anything else you maybe want to add, Supervisor Williams, of the work on trying to bring more testing.
OptumServe is in Ukiah because it has the largest concentration of people, and we need to maximize the use in order to keep it here. The state has approved an extension through August 30th. After August, we don't know what happens with the state-supported testing. That unit is not willing to do remote sampling. And so the county has staff available who could collect samples from around the county, bring it all back to Ukiah. Optum is not willing to support that model unless we pay for what's called a second lane. The second lane, at a cost of approximately $23,000 per month, would let us do some of that remote sampling. I believe there's also a cost per test. So what we're looking at various methods of funding it. We've learned recently is Medi-Cal is covering the cost of the test. Private insurance, in many cases, is covering the cost of the test when it's performed at private care. We don't want to overwhelm primary care, your local clinic or hospital, with a surveillance test. But it does seem that people are getting tests completed that way. If we were to do our own sampling in partnership with a local clinic, we would be looking at approximately $200 per sample. That's somewhere between $500,000 and $1 million per month for the county. This county doesn't have anywhere near that level of funding. And so essentially it's turning into an unfunded mandate. We're looking towards our state and federal partners for assistance. We don't have a specific plan for the coast today, but there isn't anybody in this process who isn't understanding just how critical it is. With visitors coming in, we need testing throughout the county.
And if I could add, Sarah, we have had individuals from the coast that have used OptumServe. So that has been really beneficial. Additionally, we have had several partners that have tested as people have gone to the clinic when they have been symptomatic. And so we have been watching those very closely. And what I would say is that if there were an outbreak on the coast, we would be responding to that the same as we have all of the other outbreaks throughout Mendocino County that we have responded to, with significant testing and support to come in and really identify those individuals and partner with our contact tracing and case investigation teams to ensure that we have a solid and quick response to our community on the coast to keep everyone safe and to respond on this matter immediately.
We have a question from Ron. What is the shelter-in-place expectation for visitors such as vacation rental guests?
Well, that's a very big question. It would be that you would certainly limit your time outside of your home to the extent possible. Or that would be your temporary lodging, would be your home for that period of time. Absolutely to stay home if you're sick and to not leave your place of residence if you're sick. And then, to recognize that we are in a pandemic and that the amount that you're out in public is going to increase the risk of transmission. So gatherings are banned, social distancing is required, facial coverings are required. So all of these elements must be practiced all the time when we're in the sheltering in place environment.
One common comment we're getting is still around results from testing of how are you getting your test results if you're going to Optum, but also how you're getting it if you're getting it through outbreak testing. So how does public health contact you? And then how does Optum contact you?
So OptumServe has a website that they've set up that individuals that are going to OptumServe can then go in under their registration number and access their results. And they can print those out if they need to. So those have been available. Again, it is taking 5 to 7 days for those results to come back through OptumServe. And then as far as the outbreak or testing that public health has been doing, we have been notifying our positives and then giving everyone the same notice that we should have all of our results within those 5 to 7 days as well from the labs that we're working with, and that no news is good news because we are doing significant number of testing. We've done over 10,000 tests in Mendocino County. And so the ability to be able to reach out to every individual is not feasible given the workload that we currently have and the response that we are working to ensure that our community is safe. And so we have focused our efforts on those positive tests and contacting them immediately.
We have a question from Cindy. What is the travel distance allowed for leisure and entertainment under the health order?
For our county, for Mendocino County, it's 50 miles straight line on a map. And the intention of that is to indicate for our county residents that we really need you to stay sheltering in place. Of course, this does not include essential travel, people that are traveling for business or medical reasons and so on, but we are still under a sheltering in place order, 50 miles straight line on a map for leisure and recreation.
We have a question about testing. Will there be additional testing in Round Valley as we have had a few more cases up here recently?
So we are working with our partners in Round Valley through the Round Valley Indian Health Clinic and working through the evaluations on whether or not we need to do additional testing. Through our contact tracing, we have been able to figure out pretty much where we need to go on those tests. And so that's what we've focused our efforts on as far as where there's spread. And when we have community spread, then we come in and do that more surveillance testing and the outbreak testing efforts. So depending on what we need to do. So we are working with the clinic to determine what is needed. And if we need to go up and do additional testing for an outbreak, then we would certainly do that response. If there's additional surveillance that we need to do, we've been partnering with the clinic on that.
It looks like
Yes,
we have a question here from somebody asking about schools and whether facial coverings will be required in schools and childcare settings. Recognizing that this is a dynamic situation and may change between now and when school opens. Dr. Duhan, can you give any forecast? This remains an area that's very challenging because the governor and the state have made guidances that are the ones that the schools are following. And I have been offering to, review the school's reopening plans and give feedback, but I will not be approving the school plans. I will give feedback, but I will not be more restrictive than the state, and I cannot be less restrictive than the state. So that is being worked out now with the state, and in terms of individual plans with the schools. I do not know the answer, but what I can say is that within my orders, it does allow for childcare stable bubbles, and that these could be extrapolated for schools. So as of today, you can have a grouping of 12 that includes adults, and that grouping of 12, if it's a stable group for 4 weeks or more, does not have to wear facial coverings or social distancing for the purposes of childcare. And this could be extrapolated to other groupings of children that are being cared for, like, a school. But I think the issue for the schools is that they are not able to operate school with just groupings of 12. So what we're looking for is guidance from the state about what groupings will be allowed for schools. And then also the social distancing and the facial coverings in schools is also of concern in terms of how that would be able to be followed by the schools. So I'm having my first review of reopening plans this Friday. Several schools have sent me, school superintendents have sent me their plans. I'm going to review them and meet on Friday with the school superintendents. And we'll continue to review these plans to give feedback in the coming months.
But again, I'm not approving these plans. I'm reviewing and giving feedback.
We have a question from Jessica. What time tomorrow can we expect to see the order released? And I believe that we're looking to have it released tomorrow afternoon.
Yes, that is correct, and it'll come into effect noon on Friday.
We have another question from Cheryl. What are the current symptoms that you should be tested for?
Well, the common symptoms of COVID are loss of smell and taste. People can have overall flu-like symptoms. They can have, cough and sniffles, and some people have stomach upset and diarrhea. What I would recommend is that, if you have these types of symptoms, call ahead to your healthcare facility and ask them about being tested. If you have more serious symptoms, then that would be, you should go to, for example, an emergency department, but call ahead. So often there are flu-like symptoms with stomach, respiratory issues, but this unusual added element of loss of taste and smell. Some people also have headache when they have COVID symptoms.
We have another question. What are the plans for evacuation centers during a wildfire if we have COVID-19 simultaneously? We don't have our EOC manager on here, but I'll try to answer this and welcome Ted or Becky to join in. We do have our emergency operations center is preparing and making plans of how to handle whether it's flooding, fire, a public safety power shutoff at the same time as COVID-19, and how to do things like evacuation centers safely, and how to make sure that we continue to operate even if we have more than one disaster at the same time.
I think to a lot of these questions, the answer is facial coverings.
So facial coverings and social distancing, I would agree on both of those points. And we have been looking very closely at what would happen if we do have a dual event so that we can plan for those types of things, Sarah. You're absolutely right. And I appreciate the community concern in that. And so we, like you said, social distancing, or the 6 feet, and so setting up shelters and evaluating how we would meet that occupancy and requirement while maintaining those areas.
And increased hygiene, making sure there's sufficient hand washing and limiting shared contact points.
Yes.
I just wanted to make an additional comment about the Round Valley clinic there, that they, have the ability to test people, their own patients, if they come in with symptoms of COVID, because they do have the Abbott ID Now, which is an excellent resource for people who are symptomatic. They also have the ability to do swabs and send them off to Quest Labs. So when the question was, I believe, what about testing in Round Valley or in Covelo area, there is a clinic there that also provides the type of testing that we see in our primary care clinics around the county.
We have another question regarding the signs for businesses. Where can we find the mask/social distancing signs in English and Spanish?
So there are 4 links posted on the county COVID website. There's a business link on the left bar of the COVID page. And if you can't find it, it's also on my Facebook feed. You're welcome to reach out to me, 937-3500, and I'll help get those links to you.
And we'll tag them in the comments for the post when we close. I think we have time for one more question. How are we planning to enforce the facial coverings order? And where should someone go to file a complaint if businesses aren't taking it seriously and not enforcing the masking requirement?
The complaint should be filed with the call center. The phone number is on the website. We recognize enforcement is difficult. There are a lot of obstacles. Code enforcement has essentially one officer on the coast, one inland. They're focused on businesses, not so much individuals. They're not going to be able to track someone down on the street who isn't wearing a facial covering. The sheriff's office has more personnel, but they've actually seen an increase in more serious crime And I think the sheriff is struggling to allocate resources. He has higher priorities, but also recognizes we're in a pandemic and this too is a priority. Where we can use help is if you're a business, make sure your customers are following the facial covering and distance requirements. If you're a patron, don't spend money at a business that isn't responsible. It'll take the people, it'll take our culture adapting to the pandemic and responding appropriately. I don't know that we're going to get an adequate level of enforcement when you look at the available resources and the scale of the problem, the size of the county, the number of businesses and public spaces. It really takes the people stepping forward.
So, Dr. Duhan, any final comments before we finish up today's Facebook Live?
Well, I just want to thank my Supervisor Williams and Becky Emery, you, Sarah Duquette, for being on this live stream with me today, and to let you all in Mendocino County know that the governor has been speaking with some regularity in the recent days because of the great deal of alarm of what's going across California. And there is expected that tomorrow he's going to make additional announcements specific to 4th of July family gatherings and activities and issues of community spread, and a more detailed announcement as to enforcement of statewide orders. So just recognizing that I, as your local health officer, do answer to the state, and that we will, as you do hear the governor come out with announcements like he did about closing bars, you can anticipate that there will be reactions on our county level, so that we stay in alignment with the governor, and that I am allowed to maintain local control, as Supervisor Williams pointed out so well in the beginning of our live stream. So thank you very much for your time. Thank you.
Thank you, Dr. Duhan. Just a reminder to everyone, tomorrow the new orders are going to be issued. We'll have that information shared on our Facebook, our Twitter, as well as the county website and a press release. So look for that information. And we will be back here on Friday, July 10th for another update. Thank you for joining us today, and we'll see you next time. Thank you.